All right, everybody, how are you doing? I'm yours truly, Dr. Lastimado, right here, right now at Reliable Dental Lab at our Surgical and Education Training Center, coming to you semi-live with another Viral. That's right, if this is the first time you're hearing this, although we have 5 other ones on my Facebook post page that all my doctors have already watched, a Viral is a video pearl. So this is a quick, nice technique video for all my docs back at home watching this of how we can get predictable results with our full mouth rehabilitation cosmetic cases. We have a very nice patient here. We just, as you saw in the last video, Virals, we had already done the second buy on her upper. This has been Facebook. Yes, I know, Facebook, right? Facebook, so that we can work out the envelopal function, so that we can figure out how long our incisors can be and things of that nature. We'll cover all that later on. What we're gonna do real quick is we've gone off the wax up. As you can see, we've done veneers in the fronts, 2 bicuspid, 2 bicuspid. Thank you so much for the team in the back doing all that. And then, as you saw in the last video, we had already prepped, and we have done our provisionals, and we've done some laser surgery to make the gingival zenith all at the same height. So this is from the time of original prep. This has been about 6-7 weeks to allow for full healing. Obviously, you can see that our temporary has seen some usage. But now we want to convey, because she's been functioning in this temporary, and we want to convey really the function of the temporary to the lab for occlusion as well as aesthetics, meaning does the patient like the shape of the wax up? Sometimes our patients don't. So the best way to do this, doctors at home, because we just got a case today and the patient doesn't like the final restorations because the doctor just went off the wax up, which is fine. But a nice little step is to make any adjustments that you need in the mouth on the temps. So this is the final impression appointment. So what I'm going to do here is just my awesome assistant, Deanna. I'm just going to use a ultra light body or an injection. You'll see this again as I'll share with you in the next Viral that's coming up, how to do predictable full arch impression techniques. So I'm actually going to take, an impression of the temporary. Oh, so we're just going to go around and capture the gingival zenith, so that the lab now, when I tell them please match gingival zenith heights, they now have an impression of her functional temporaries. So it's a nice technique to do that. Just put that like so. And then we're going to do capture the occlusion, because we've actually worked out occlusion, no broken temps. So we want to tell, and open for me, dear. We want to convey to the lab as much information as possible. And you guys know me, a little bit of a classic Gordon Christensen technique. See if we can't blow it in. I don't get much air out of that guy. There we go. And I kind of shove that down, and my assistant's gonna pass me a full upper tray. Please stop taking triple tray impressions, doctors. We get so much distortion in the impression. Take full upper arch tray impression. That's really the way to go, so we can get predictable results, and we won't need the palette or anything like that. So we got it. Excellent. Very nice. Perfect. Okay, so got a big tray open real big there, big. Get that in there. Okay, and we're just going to take a nice PVS impression. You could take alginate, but my recommendation is just go ahead and take PVS. That way, if the lab needed to pour it up again, maybe your first pour, if you decide to pour your alginate impression, doesn't come out right, just take PVS, it's fine. That way you have a static record to always work with and always use it as a reference. And that is it. As they say, join us, visit us, tell others about us. You can visit us at rdldental.com. Yours truly, Dr. Lastimado, to see about all of the nice services and products here at Reliable Dental Lab here in Dallas, Texas. Or you can visit yours truly, Dr. Lastimado, at dentalcetrain.com. Check us out in a few more minutes. We'll have another Viral on final impression techniques for success. All right, as you know, check us out. Boom.